Welcome back, and thank you for keeping it TV 47. Of course, this is Body Garage, where on this episode we are focusing on chronic kidney disease, and with me is Dr. Hussein Bagha. Daktari, before the break, we discussed how follow-up care for someone who has undergone kidney transplant, and you said that they would have to be on medication sometimes for life. Why would the body reject the kidney that has been donated?
So that is a very good question. The kidney that has been donated is foreign tissue. So the body identifies it as foreign. So it will start fighting it, thinking that it could be something like a bacteria or whatever else it is. So that's why we have to suppress the recipient's immunity for him not to reject that kidney.
That particular kidney. Yeah. Let's take a look at some of the complications connected with chronic kidney disease. Can it increase the risk of cardiovascular diseases?
So the most common cause of death from chronic kidney disease is not directly related to the kidney, but is from cardiovascular disease. So more than 50% of our patients pass on or die because of cardiovascular death disease, not because of the kidney itself. And that's very important to understand. Yeah.
Are there other parts of the body that are also affected once someone has chronic kidney disease?
Yes, so your lungs can get affected because of the accumulation of fluids within the lungs. Patients with chronic kidney disease, especially the later stages, and even those who are on dialysis, tend to get a lot of cognitive impairments as well, and it increases the risk of dementia as well. So even the brain tends to get affected, your nerves tend to get affected as well, so they tend to get what is called peripheral neuropathy, so they tend to get numbness or tingling sensation in the hands or feet. So it can affect almost all the organs in the body.
Okay. And when now someone is living with this particular disease, what should they look out for so that it doesn't worsen?
So as I mentioned earlier, you have to look at what caused the kidney disease. If it's diabetes, if it's high blood pressure, you have to control your blood pressures, you have to control your blood sugars. So for me, all patients with chronic kidney disease should have blood pressure machines at home, should have machines to measure their blood sugars at home as well. They need to eat healthy, they need to exercise regularly, they need to go for regular checkups as well. I mean, of course, if they see that a new symptom has developed which was not there, like let's say the legs suddenly start getting swollen or the urine output has suddenly reduced more, then they need to go to the doctor immediately and have it checked out. So anybody living with chronic kidney disease should always be on the watch out for any symptoms that were not there before developing. So even if they get a lot of nausea, a lot of vomiting, it could suggest that the kidney disease is worsening. And they need to get it checked out immediately.
So they should always be on the lookout.
Yes.
Okay. You have emphasized the need for eating a balanced diet. For someone now with chronic kidney disease, are there dietary changes that they have to make? Are there some things that they need to stop doing?
So especially when it comes to stage 3 onwards and stage 4 and stage 5 kidney disease, a lot of the kidney functions start deteriorating. So your electrolytes, especially what we talk about, your potassiums, your phosphates, they tend to start going up in the body, and those are not good. So you need to, of course, work hand in hand with your nephrologist and your nutritionist to start looking at kidney diets. So we tend to avoid foods that are very rich in potassiums, like avocados, like bananas, even foods that are very high in phosphates, like we talked about in the previous episode about your green leafy vegetables. So we need to leach those. And by leaching, we mean that you soak them in water for at least 1 to 2 hours and then wash the water away, and then you can cook them. But of course, everything is supposed to be in moderation.
In moderation.
Yes.
Okay. Now, when you're managing chronic kidney disease for someone who has diabetes, say they have been transplanted how does it look like?
So if somebody has been transplanted, of course, that's the best thing that can happen. And if the kidney is a successful transplant, that's very good. Of course, you have to make sure that your sugars are going to be well controlled. Remember that you're on medications to prevent your body from rejecting the kidney. So that can cause problems with your sugars, because your sugars tend to go up because of the steroids that we use and also because of the other medications that are part of that regimen. So you need to be very closely monitoring your blood sugars, and then coming for regular checkups as well. And then of course your diet also is very important as well in terms of helping to control your blood sugars and making sure that your kidney is functioning well.
Dr. Why is it that when someone has undergone a kidney transplant, they often tend to lose weight?
So patients who have undergone a kidney transplant, they don't tend to lose weight, but it's just that they become more cautious with their diets. They are exercising more. So that's among the reason why they tend to become a bit more cognizant of their weight and their BMIs and try to keep their weight under check. Actually, patients who have undergone a transplant actually tend to gain a bit of weight because of the medications like the steroids. Yeah.
Okay, let's move to, how long can someone now live after a kidney transplant?
Well, they can live for a very long time as well. I mean, the longest patient that I'm following up with the kidney transplant was transplanted when I was still a child.
Oh.
Yes. She was transplanted in 1996, and she's doing very well. Yeah.
Okay, that's quite heartwarming.
Almost 29 years now.
Yes.
Yes, going to 30.
Okay, let's take a look also at preventing now chronic kidney disease. Is it preventable?
Of course, any disease is preventable, especially the chronic diseases. You have to know whether you are at risk or not. As I mentioned earlier, the risk factors are if you have diabetes, if you have high blood pressure, if you have a family history of kidney disease, if you're obese, if you have had acute kidney injury before which recovered fully, you are at a higher risk. Chronic kidney disease is preventable. First, you have to know whether you are at risk of developing chronic kidney disease, whether you have the risk factors for developing chronic kidney disease like diabetes, high blood pressure, if you're obese, if you had a family history of chronic kidney disease, if you have had previous acute kidney injury which recovered fully. So all of those puts you at risk of developing chronic kidney disease. So you need to go for regular checks if you are at risk. Number two, if you have diabetes and high blood pressure, you need to control those. I mean, there's no two ways about it. You need to control your blood pressures, you need to control your blood sugars, you need to go for regular checkups with your doctor as well. Avoid over-the-counter medications, please, I can't overemphasize that. Avoid herbal medicines as well, because those have not been tested and they react differently with different people as well. So that's very important. And of course, keeping yourself well hydrated, another very important thing as well. And then eating healthy and exercising. Yes.
How about smoking, Dr.
So smoking does not directly cause kidney disease, but if somebody has kidney disease, it does increase the risk of progression to end-stage kidney disease. Smoking causes heart problems, and the heart problems will lead to chronic kidney disease. Smoking causes lung problems. Lung problems can also cause kidney problems as well. So smoking is a no-no from all aspects.
From all aspects. And perhaps someone is wondering, does the quality of life get impacted once someone is, diagnosed with chronic kidney disease?
Yes, it does. I mean, as the disease progresses, you tend to lose a lot of strength, you tend to get tired very easily, your blood levels are low, your risk of developing infections becomes higher, you tend to get admitted more frequently as well, and especially in end-stage kidney disease, if you're on dialysis, you have to come a minimum of twice a week or sometimes even thrice a week for the next foreseeable future until you're transplanted. So definitely it does affect your quality of life quite a bit. Yeah.
And for someone who is expectant, is there a dialysis option for them? How does that?
So when you have reached end-stage kidney disease, your chances of getting pregnant become much less because your hormones are all affected, but some people still end up getting pregnant. Then for them, dialysis is still an option. Although we have to adjust the dialysis timings, we have to increase the number of hours they are on dialysis, because of course we have to make sure that within the body the milieu is kept as normal as possible for the pregnancy.
And Dr. when we were talking, it's about lifelong medication, and sometimes there's medication fatigue. How then do you advise your patients who are on this, they have chronic kidney disease and they need to be on this medication, but sometimes can be tiring?
It can be tiring, but you see now you can look at it from two aspects. Those who have chronic kidney disease, so you don't want them to progress to end-stage kidney disease. So it's important to talk to your patients, counsel them regularly. We're all human beings. We get tired. Okay? And nobody wants to end up on dialysis. And then there's the other aspect of those patients who have been transplanted.
Yes.
They are also supposed to have medications for the rest of their life. And again, once when they feel better and everything is improving and they're no longer coming to the hospital for the regular dialysis after 6 months, 12 months, then they feel like, oh, everything is okay. Some people who tend to stop their medication. So again, it is all through rigorous counseling, constantly checking up on your patients, reminding them to take their medications. And it's important to work with your nurses as well. They're very integral in this, your transplant coordinator.
Okay. And for the donor for the kidney transplant, are they also amongst those who would be on lifelong medication?
So the kidney donor is not on any medication. They are basically, they can get back to their normal life after 1 month. And they need to, again, eat healthy, exercise, hydrate themselves well. And even for them, they need to be on regular checkups. Initially every 3 months and then every 6 months. So that's very important. Yeah.
And as we wind up, Daktari, perhaps your pro tips for someone who has chronic kidney disease, perhaps your advice to them, and also for someone who has not yet got the chronic kidney disease, what is your advice?
So one thing is that chronic kidney disease is not a life sentence. I mean, when I first came back to Kenya, it was more than 10 years ago when I came back as a qualified nephrologist, and I would tell somebody that you have end-stage kidney disease and require dialysis, and they would break down totally, and they're like, oh, I need to go see my lawyer and sign a will, and that is not true. Patients have been on dialysis, if you can't get a transplant, for almost 50 years, and they've been living okay. I'm not saying that patients should only be on dialysis. Ideally, transplant is better than that. So there are treatment modalities available for chronic kidney disease, but you have to make sure that it is diagnosed early so that you can prevent the progression. Even if it's diagnosed late, it's not a death sentence. As long as you follow your doctor's instructions, follow the treatment guidelines and the regimen that your doctor has prescribed for you, it is going to be okay. For those who have not developed chronic kidney disease, it is important to keep your kidneys healthy. And one of the ways by doing so is by going for regular checks, especially if you have risk factors for chronic kidney disease, and maintaining a healthy lifestyle.
Maintaining a healthy lifestyle.
Yes.
Thank you very much, Daktari. It was a pleasure having you on the show.
Thank you.
All right, and for you back at home, it's always a pleasure having you in on each and every episode. Thank you for keeping it TV47 and of course Body Garage. Until next time, it's goodbye and good night.